has been said, and I, on behalf of the United Nations, on behalf of UNAIDS, we fully support the engagement leadership, in particular, bringing on blended financing, stable, really promising, very timely, important mechanisms to really engage all partners, particularly from the private sector, to meet the dialogue in Africa, in sub-Saharan Africa. Let me just share just a couple of points from our recent World AIDS Day report. We did some new analysis looking at funding trends on HIV in sub-Saharan Africa. And there is a misnomer, almost a myth, in many development circles that the more international development partners put in, the more the PEPFAR puts in, the more the Global Fund puts in, it actually lets partner countries globally, including in Africa, so to speak, off the hook, and therefore there's a risk that they will be putting less funding. So we actually ran the numbers, and we came across a very interesting list of 9 countries that for the last 4 years, 2018, 19, 20, and 21, had significant increases in funding from PEPFAR and from the Global Fund. But they were matched by significant increases in domestic financing for HIV in these countries. Countries are, and this is not all the countries where this is happening, this is only the countries where we got reports of UNAIDS and we were able to actually do the analysis. The true list may be longer, but Botswana, Ghana, Lesotho, Malawi, Mozambique, Nigeria, South Sudan, Togo, Tanzania. And so these are countries that are facing a number of different public sector pressures. But in a sign of global solidarity and shared responsibility, the governments are stepping up, perhaps even outside of their comfort zone, to provide more funding for HIV and also leverage the potential of decades of investments in HIV to put them to work for larger progress across the health sector, including for women's health, including for maternal and child health, including for non-communicable diseases. And across all of these areas, they produce many-fold investments beyond just HIV for women's health and women's empowerment across sub-Saharan Africa. So on behalf of UNAIDS, we're very pleased to be joining the Women's Health and Empowerment Network. We will, and I've agreed this with our sustainable financing team, also be joining the Sustainable Financing Working Group. Happy to contribute to the work in this area and really look at strategically how can we move forward and build on progress in HIV. AIDS is not over, particularly in sub-Saharan Africa. There's a lot of work to do, but the opportunity we have now by really putting these amazing constellations of partners around the table to look at strategically how can we put these investments in these partnerships to work for not just ending AIDS, but to really move the dial very quickly, even before 2030, on women's health and empowerment.